Thank you all for being here today on International Chagas Disease Awareness Day. Chagas disease is the third most common parasitic disease in the world, leading to heart failure and death in 1 in 3 people who are infected. In the U.S. medical system, Chagas disease is thought of as a disease that is only seen in Latin America. But there are an estimated 300 individuals in the U.S. who have this illness. The Latin American immigrant community of Virginia is also at a high risk for this illness. Chagas disease can cause grave disability or death in the prime working lives, usually 30 to 50 years of age, and 12,500 people die from this illness every year. Northern Virginia in particular is an area of the U.S. in which Chagas disease is likely the most prevalent per capita. The metropolitan Washington area is home to the largest per capita percentage of El Salvadoran immigrants in the country. And there are estimates of a Bolivian immigrant community that numbers from 70,000 to 200,000 individuals. The Bolivian community is particularly at high risk, and that many immigrants come from areas in Bolivia in which up to 70% of inhabitants have Chagas disease. In fact, Fairfax was the site of the first diagnosis of congenital Chagas disease in the U.S., reported in July of 2010. In addition, a 17-year-old girl in Arlington who acquired the disease congenitally was recently treated. I was proud this year to actually try to raise awareness about this issue in the Virginia General Assembly. And I'm proud to say the Virginia General Assembly is the first state and the first state legislature to actually talk about Chagas disease. And so I'm today going to be having some of my friends talk about some of these issues, and I want to welcome everyone. But right now I'd like to introduce someone who's actually suffering from Chagas disease, who's going to tell his story. Carlos? Yeah.
Bueno, gracias por haberme invitado a esta reunión.
Thank you for inviting me to this meeting.
Para mí es de gran importancia esta reunión porque en la situación que yo he pasado,
This meeting is of very grand importance to me for everything that I am suffering currently.
yo fui detectado del mal de Chagas en Boston,
I was diagnosed with Chagas disease when I lived in Boston,
y me tocó que estar 6 meses ingresado en Boston.
and he had to be in the hospital for 6 months when he lived in Boston.
Y es bien difícil tener esta enfermedad del mal de Chagas.
It is very difficult to live with this disease of Chagas.
No se puede trabajar, todo eso es bien incómodo para hasta dormir, todo molesta la situación.
The disease makes it very difficult for me to work or for me to sleep. It really has affected my life.
Sí, me pusieron este aparato para que yo pudiese esperar, ahorita estoy en espera del trasplante.
They gave me this equipment for me to have, and I'm currently on the wait list for a heart transplant.
Ya tengo 4 años de estar esperando
I've been waiting for the last 4 years
para poder que me quiten este aparato que ando llevando.
so that I would no longer need to have this equipment.
Así que no es fácil esta enfermedad del mal de Chagas.
This disease is very difficult to live with.
Así que si se pudiese combatir antes, fuera bueno, porque así no padecen otras personas la situación que yo estoy pasando.
It would be great if we could prevent this disease earlier on so that other people do not need to suffer the way that I've suffered.
Así que solo estas son mis palabras. Gracias.
Thank you so much for listening to my words. Hi, my name is Liliana Hernandez, and I'm a resident here of Arlington. And I brought forward to Delegate Alfonso Lopez the need for us to increase awareness about Chagas disease. My aunt, Dora Capunay, was diagnosed with Chagas disease when she lived in Colombia. She passed away from us 5 years ago, and this is really a memory to her that we need to increase awareness about Chagas disease and increase the prevention and treatment for those patients that are currently living with Chagas disease. When we lived in New Jersey, she luckily had some doctors who were very patient and worked with her, but most of the medical community was unaware of Chagas
Now, I'd like to make the official presentation of the resolution to Jenny Sanchez, President of the Latin American Society for Chagas, who will give us a few words about what's being done in the U.S. to address Chagas disease. If Jenny could come up for a second. Hey there.
Hi.
How you doing? Thanks for coming.
Thank you.
This was agreed to by the House delegates on February 25th, 2016, and agreed to by the Senate on February 23rd, 2016, unanimously. I'm going to just read a few words. Whereas Chagas disease, a parasitic infection that is typically transmitted by insects but can be congenital, can persist in the body for decades and lead to serious heart problems such as heart failure, stroke, and heart rhythm disturbances later in life. And whereas also known as the kissing bug disease, Chagas disease affects 8 to 10 million people worldwide, many of whom are in Latin America, and is the third most prevalent parasitic infection in the world. 1 in every 3 people who contract the disease develop a lethal heart condition, killing more than 12,000 people each year. And whereas it's estimated up to 70% of the population in some provinces of Bolivia have Chagas disease, and the populations of El Salvador and other Central American countries also show high rates of infection. And whereas the Commonwealth is home to more Bolivian immigrants than the number living in New York and California combined, and the Washington metropolitan area is home to the largest per capita population of El Salvadoran immigrants in the country, at least 300 people in the United States have Chagas disease. Whereas many doctors are unaware that Chagas disease can be found in the U.S., the economic toll of Chagas disease is estimated to be considerable, with more than 10% of that cost, or the overall cost, incurred in the U.S. and Canada. Be it resolved by the House delegates, the Senate concurring, that the General Assembly designate April 14th in 2016 and in each succeeding year as Chagas Awareness Day in Virginia. I'm proud to say that Virginia is the first such state to address this issue, and hopefully we can get other states to do the same thing. Thank you very much.
Thanks.
You go.
Mr. Alfonso Lopez, member of the Virginia House of Delegates, representative of Virginia Health Department, Dr. Rachel Marcos, Director of Latin American Society of Chagas, and the most important person for this room, you, our patient. It's a great honor to be here today. The Sanchez stand for Latin American Society of Chagas. We're a young non-profit organization registered in Virginia as a corporation since 2013 and gained a federal tax exempt last year. I would like to tell you how my interest in Chagas disease started. Back in 2002, I was pregnant, so I went to start my regular pregnancy control, and I asked my doctor to be tested for Chagas disease. At first, he didn't know what I was talking about, so I thought probably my accent was getting on the way, or I wasn't expressing myself very well. So next visit, my husband expressed himself better and with no accent, but the answer was the same. So the doctor was telling us that he would do some research about it and he will get back to us. Along the pregnancy, the doctor told us that it was best for us to wait until we go back to our home country and get tested. Fortunately, everything went fine with the pregnancy, and years later, I got tested negative. I know that's not the case for several women coming from a country where the Chagas disease has a high incidence. So I was very lucky to be negative, but like I said, that's not the case for other people. So I knew I needed to do something. So I started meeting with people, and I didn't know that I wanted to, I started an organization to raise awareness about Chagas disease. In a search of help, I met Dr. Marcos, and who is a person that has a heart for helping people and helping patients with Chagas disease. I wanted to just end saying and thanking all of you and thanking our delegate for taking the interest in this issue.
Thank you. Appreciate it.
Thank you.
Anyone else speak? No. Dr. Mark, is that the same deal?
Thank you. So the most important thing that I can say today is thank you so much to Dr. Delegate Lopez for bringing this to the floor of the Virginia delegation. Chagas disease is considered a neglected disease of poverty. It's an illness that's transmitted by an insect that lives in Central and South America, but actually also in the United States. And it is a disease of poverty. And because of this, not much research or research dollars have been dedicated to this particular problem. We are now trying to raise awareness for this illness in the United States because we know that so many people have immigrated here from countries where Chagas disease is prevalent. And as Jenny so very compellingly told you, very few of them meet doctors who actually know anything about the illness, except for what they remember very briefly from a lecture in medical school. We have been trying to change that, both by screening individuals ourselves, by reaching out to health clinics and doing in-services and teaching lectures, and by meeting with members of legislatures. But this Chagas Awareness Day bill, we think, will be critical to expanding awareness of this illness and hopefully being able to shine more light on the disease. Just very briefly, what Chagas disease does is it infects the body initially with an infection. It is very self-limited and most people don't know that they have it. Most of the people in the United States who were infected with this parasite were infected as children. And then about 15 to 30 years later, 20 to 30% of them will go on to have heart problems, some of which can be life-threatening, including heart failure, stroke, or heart arrhythmias. These are things that can cause grave disability in people in their prime working years, as you've already heard from Mr. Tovar-Besa, who has basically been prohibited from any sort of gainful employment since he was diagnosed with his illness and requires heart transplantation in some. This is a cost of millions of dollars of loss in wages and healthcare costs. So we think this is really a critical illness to try and identify to help people live healthy, productive lives, and are very thrilled to have the opportunity to be able to speak at an event that's raising awareness of this disease. Thank you so much for your participation.
Thank you everyone for being here today. It's really greatly appreciated. And I hope that this one resolution now will be the foundation by which other states will begin doing similar resolutions. And hopefully we can raise awareness across the state, across the Commonwealth, across the country, and get more doctors actively thinking about this and maybe doing research on this horrible disease. And I especially want to thank you, sir, for coming today and sharing your story. Thank you, gracias. And thank you all very much. Look forward to seeing you soon.